As you probably know, people that decide to stay in original Medicare A and B will get a supplemental plan to fill in the gaps. The two most common plans today are the G and the N. So let's make a quick comparison between these two plans to determine which is better for your specific situation. Welcome to Medicare School Daily, where we help you understand Medicare, save money, avoid making mistakes, and above all else, get the most out of your Medicare coverage. Now, today's topic is actually a question about supplemental plans. First of all, to understand supplemental plans, we have to be reminded of the gaps that exist in original Medicare. These gaps are your financial liabilities. Medicare pays first, but these gaps will be your responsibility. And so we have three gaps on the A, and those are these. If I go to the hospital, my gap or my responsibility for that hospital stay is the deductible of $1,556. And deductible means that you have to pay first and then Medicare begins to pay. Now, with this deductible, it is not annual. Most of us that have group plans or individual plans are accustomed to annual deductibles. The A deductible is not annual. It's actually tied to what is called a benefit period. Now, benefit period begins when you're put into the hospital. Benefit period lasts while you're in the hospital. And then from the day you're discharged, the benefit period continues on for a full 60 days. So from the date of discharge for the next 60 days, if something were to happen to me that would cause me to be rehospitalized, I am still in the same benefit period and covered by the same deductible. But if I'm hospitalized, 7 days goes by and I'm discharged, and then 60 days goes by and nothing happens to me that causes me to be rehospitalized, but it happens after that, and I go back to the hospital, then after being discharged of 60 days, then I would be responsible for another deductible and I start a new benefit period. All right, so that is going to cover us for most situations. So anywhere between 1 day to 60 days, anything in between there, the same will cost me out of pocket $1,556. Now that's the deductible for 2022. These usually go up a little bit every year. Now, if I'm in the hospital longer than 60 continuous days, now we get into our second gap, which are hospital copays or extended hospital copays. So month 3, month 4, and month 5, Medicare begins to charge daily copays. They get very, very pricey, and this would be what you would be responsible for. Again, those are very rare, but when they happen, they are expensive. And then lastly, Medicare Part A also covers skilled nursing facilities. This is when someone's had a stroke or maybe a hip replacement or some injury or accident or something has happened where they need intensive rehab. So here's the rules. Skilled nursing costs are covered this way. Medicare says that as long as you were in the hospital 3 days or longer, then the doctor can discharge you from the hospital, send you to skilled nursing, and they will cover everything for the first 20 days. Does not cost you a penny. After 20 days, if you're still in need of skilled nursing care, Medicare covers you for the next 80 days, but you're responsible for a daily copay, $194.50 for 2022. And so this ends up being on the average about 10 to 15 days. They say the average recipient right now receiving Medicare when they go to skilled nursing is in between 30 to 35 days. So as long as I had a 3-day hospital stay or more, the first 20, Medicare paid for. But the next 10 to 15 days after that, I'm responsible for the daily copay. So those are our gaps on original Medicare A. Means you're liable for these things. Now let's talk about the gaps on B. And again, B is the outpatient side of Medicare and all doctor-related services. So all docs and outpatient is covered through the B system. We have a B deductible in 2022 of $233. Now this deductible is not like that deductible. This could happen more than once in a year. This is only for 1 calendar year. So if I start my Medicare July 1, then this is my deductible from July 1 to December 31st, and then this deductible will reset every January. So you have to pay the first $233 of anything on the B side. Outpatient services and all doctor-related services. After my deductible is met, I take my second gap, and that is going to be called coinsurance. Whenever Medicare covers something on the B side, outpatient and doctor services, they cover it at 80%, and you're responsible for 20%. And that 20% is unlimited. It never stops unless someone gets insurance. And so this actually is one of the biggest risks that you have in original Medicare. Medicare pays 80 and you pay 20. Then our third gap is called excess charge. Now this is when you go to a doctor that takes Medicare patients, but does not agree to take Medicare-approved reimbursement amounts. In other words, when they look at the fee schedule that Medicare pays, they say that's not enough, and they add to the bill. When they add to the bill, the most they can add is 15%, and when they do so, that's an excess charge, and you're responsible for all excess charges. Medicare allows it, but you have to pay for it. So again, those are our three gaps on the B side of Medicare. All right, so now let's do a comparison between Supplemental Plan G and N. And so if you do buy a G plan, that G plan, that coverage, will actually cover 5 of the 6 gaps that exist in Medicare. It covers all 3 on the A side, which means you would be out of pocket nothing on the A side of Medicare for the hospital or skilled nursing. On the B side, you're out of pocket one item, and that is the B deductible. And so this would be the first $233 of bills that are generated through the B of Medicare, which would be doctor visits, lab work, maybe cataract surgery, or an MRI. But the first $233 of the B side of Medicare, you're going to be out of pocket on it. That's actually going to come to your mailbox in the form of an invoice. But after that, everything else will be covered 100%. And so this is just once a year, and then it resets every January. So you can see it's almost a full coverage plan, not quite. As long as Medicare pays first, that G fills in all the gaps, but once a year, $233. Okay, now let's look at the N plan. Again, a very popular plan today, and it's going to cover 4 of the 6 gaps. Medicare G covered 5, Medicare Supplemental Plan N covers 4 of the 6 gaps. Again, it covers all the gaps on the A. It doesn't cost you any money to go to the hospital or skilled nursing. The Medicare Plan N will cover all those gaps. But we get to the B side, here's where it's going to differ. Just like the G does not pay the B deductible, nor will the N. You're responsible for the first $203. Then we go to coinsurance, and again, that N plan will cover that 20% fully. So Medicare pays the doc 80, and the 20 is on you, but that N plan will cover that. And then you are responsible, though, on the N plan for excess charges. So when a doctor adds the 15%, you'll be responsible to pay for that. And again, not a high risk today in 2022. We see about 1 out of 10 doctors do that, but that could change in the next 10, 15, 20 years. And so when you make that decision, you got to decide, am I concerned about excess or not? Do I want to pay that excess out of my pocket if and when it occurs, or would I prefer to get insurance to cover that? That's the decision that you're going to have to make. So let's make just a quick few comparisons between the G and the N plan. Okay, first off, the N plan, beyond these two responsibilities that you have, these 2 gaps, you'll also have to pay every time you see a doctor or you see a specialist or any kind of a physician, you will have to pay that physician a $20 copay. Anytime you go to the emergency room, you would have a $50 copay. Again, very reasonable, but that again is the difference between the G and the N. A G covers 5 of the 6, N covers 4 of the 6, and then N also you have a $20 copay anytime that you see a doctor. All right. So what are the differences between the two financially to you? Well, the premium is certainly going to be lower on the N plan. Now, again, we do business all over the country, so I'm just going to give you some averages here. The average premium difference between the G plan and the N plan is about $25 a month, which means if someone is on an N plan, they're going to save $300 for the year. And for that savings, what are they doing? They're agreeing to pay any doctor they see $20 copay, and they're agreeing that if they see a doctor that charges excess, they will pay that fully. And you just have to decide, is that premium difference worth it to you or not? And then we also know that beyond the excess charge you're responsible for, you also have the risk of switching. Now, in 43 of the 50 states, whenever you decide that you would like to switch companies or switch letters, you want to move from a G to an N, or an N to a G, you're going to have to medically qualify. And so once you get a plan, if your health were to change, it's very likely that that will be your Medicare supplemental plan for the rest of your life. Now, again, there are some states, 7 of them, that do have some exceptions to the rule. But by and large, once you buy that supplemental plan, the first 6 months of being on the plan, you can have anything you want. But after that, if you want to switch to a different plan, then you're going to have to medically qualify to do that. We're going to have to ask you 25 or 30 health questions, check your medications, maybe get a statement from your doctor. That's the process of switching plans. So sometimes people will say, well, I think I'll start with an N plan and then I want to switch to a G plan as I get older. Well, you may or may not be able to do that depending upon your health. All right, so those are the differences between the G and the N. And folks, they're both good plans, wonderful coverage. There's not one that's better than the other, but you have to make the decision which is going to be best for you, that G plan or the N plan. Hey, thanks so much for watching the video, and I do hope that it was helpful. Now, if you feel like you need to learn more about Medicare to make sure you're making the right Medicare decision, really the best way and the easiest way to do that is to go to MedicareSchool.com. That's MedicareSchool.com, and you'll be given the opportunity to click on Get the Free Workshop. We call that the Essentials Workshop, and I do all the teaching, and there you'll learn all the ins and outs of Medicare to make sure that you have an accurate and thorough understanding of how Medicare works. The second thing you can do is click where it says Talk to a Medicare Guide, and there you can actually set up a time where you can discuss your situation with the Medicare Guide. They'll explain all your options, and they'll actually even walk you through the enrollment process as well if that's what you need to do. And so go to MedicareSchool.com, watch the workshop, or talk to a Medicare Guide. It would be our privilege to assist you further.